Hi, my name is Dr. Curtis Quinn. I'm a board-certified thoracic surgeon. Thank you very much for visiting my website. I've had the pleasure and honor for the last 22 years of taking care of thoracic surgical patients. And these patients have been some of the kindest, bravest, most forgiving people that I have ever met. And through this experience, I found that when someone comes to talk with me because they have a spot on their lung, a lot of the things that I share with them as far as what the plan would be to work this up and biopsy it and what it may be, the information that I share with them is not really registered, it's not remembered. There's such a onus, a fear of it being a cancer that people leave and then they call my medical assistant back and they have all these questions and I'm like, well, I addressed them in the office, but it's too much, it's too overwhelming. This is a time of incredible technological advances, and I can see that for me, the art of medicine is humanizing technology so I can take care of my patients. And in the same venue that I've found if I needed to learn how to upgrade the RAM on my computer or figure out which float valve to replace in my toilet or what pop-up camper to buy for my family, I go online and I look these things up and they're readily there. And in an effort to try to help my patients, I realized that there's really not a lot of patient-centered information online. There's a lot of medical documentation, there's a lot of information saying how we do things better than other people, but there's not a lot of facts, a lot of information that's directed patient-centered. And our patients these days are smarter, and I think they do want to go online, and I think they do want to know about what condition they have and how this can be worked up and what their options are. So my goal here with this website is to educate people in exactly what is happening to them. Benjamin Franklin, who I think is one of the most incredibly smart humans ever to be born, has a quote that really grabbed me, and it says, "Tell me and I forget, teach me and I remember, involve me and I learn." And what I want to do is I want to involve my patients on a much deeper level than me telling them what to do. Sure, I want to direct the ship. I'm going to be captain of the ship, but they need to help navigate because it's their body, their precious cargo that we're sailing through these treacherous waters. And I want them to be able to have the information, to be empowered, to be able to make decisions based upon what things are available. Every decision you make has a plus and a minus. Every treatment has a good point and a bad point. And you need to weigh what is right for you. We are really in the era of personalized medicine. We need to tailor whatever treatment we suggest to your physiologic state, your mental state, and your social state. Maybe you can tolerate surgery, but you're the sole caregiver for your spouse, and being in the hospital for 5 to 7 days is not going to cut it for you. And we need to respect that because there are many great options. As this technological information has been growing, so has some incredible advances in lung cancer. Probably one of the best ones is in lung screening. 2011, the NLST paper was published proving that doing low-dose CAT scans on high-risk patients that have smoked for a while of a certain age clearly has found early lung cancers. And it took 5 years for Medicare to realize that and to begin reimbursement. And as we speak right now, it's still taking hospitals and insurance companies to understand how powerful that is, how great this is. When you look at lung cancer deaths, lung cancer kills more people than breast, colon, prostate, pancreas combined yearly. It's a terrible disease. It's got a lot of onuses to it that there's no pink ribbons to. People do not get the same treatment or the same funding that a lot of the other cancers get. But with lung screening, we can find these cancers early, and that is the one way to provide a cure. So I want to try to have an inclusive website that if you've got a spot on your lung, you already know you have cancer and you need a lobectomy, or you're going to have CyberKnife, or you need a med port put in, or you need some type of navigational biopsy, you can go to, look at what that procedure entails, what are the risks and benefits, what are the stages of lung cancer, what treatment will be right for you, and hopefully you'll have enough information that when you go to see your surgeon, your pulmonologist, your oncologist, you'll be able to ask the right questions to get the information that is going to help you make the best decision as to what is right for you. I'll tell you that one of my main professors taught me, and I'm very fortunate, the two most important rules in thoracic surgery. Dr. Ben Daly from Boston. Rule number 1, always do the right thing for your patient. Rule number 2, when in doubt, see rule number 1. I feel very strongly that what we're trying to accomplish here is the right thing for our patients. It's a work in progress. If you see things about it you like, please email us. If you see things about it that you don't like or you disagree with, please email us. We're very willing to learn. I've learned incredible amounts from my patients as I've taken care of them over the years, and we want to learn from everybody out there. And I just want to say one thing, is that this site is dedicated to my mom, Claire Sylvia Quinn, who was the best mom a guy could ever have and was a brave fallen soldier in the war against cancer. So again, thank you so much for taking the time to come visit this site, and I hope that you learned something from it.